Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health Center, reporting for the week of May 22nd, 2023. Following a status update on COVID and Mpox, I will review the relationship between COVID and cognitive or brain functioning. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Our data sources continue to pose a challenge, but I will start here with the CDC's new COVID data tracker, and it shows hospitalizations are on a downward trend, as well as deaths. And when we go in a little further, we can see the weekly trends in COVID-19. New hospital admissions are coming down. They're not coming quite down as far as we'd like to see them, but they're more or less heading in the right direction, or maybe plateauing just a little bit. We've had 9,204 admissions the week ending May 13th, and currently in the hospital with or for COVID, there are 8,175 people hospitalized at this time. And looking at this map, this shows the change in weekly COVID hospital admissions by county. And so there's a lot going on this map, but if you're interested in what is going on in your county, this is an interesting map to drill down on. The link to it is in the post, but it basically can tell you if things are, what direction things are heading in. And as you can see, there's a number of red counties which are showing a substantial increase in hospital admissions from the week before. So I think this is going to be an important map to keep an eye on as we move forward. And in total, so far in this pandemic, 1,131,950 people have lost their lives due to COVID, and these are confirmed deaths. And of those, 37,132 are this year in 2023. And the last week where we have finalized death numbers is the week ending April 22nd, so a month ago, but we were at 1,082 deaths for the week, and that is the lowest in the pandemic for the fourth week in a row. So this is definitely welcome news, and we can just hope that it will continue to go in this direction. Taking a look at wastewater, and similar to what I said about the hospitalization by county, this right now appears to be something that will be helpful to look at if you can drill down into your particular area. So if this is of interest, and if you are in one of those areas with a lot of dots, then this may be actually useful to you in your area to take a look at what is going on or what is coming. This is the earliest indicator that we have when SARS-CoV-2 is on the rise, but it's really variable from location to location as to how helpful this will be on a kind of a neighborhood or a city level. But you can see that there are a fair number of red and orange dots here. And this is again looking at the percentage of change over the last 15 days. So this is something that as we move into the summer months, we're going to want to keep an eye on to see if we can find any correlation between increases here and then maybe how they might impact emergency department or hospitalization or even later on deaths. And variant proportions, unfortunately, the variant proportion tracker has not been updated at all since the last time I reported. So this is actually the same slide that I showed last week. And so it has not been updated. We do know that XBB.2.3 was just added on May 18th to the World Health Organization's variant under monitoring. So XBB.2.3 has kind of been upgraded in its status of what the World Health Organization is tracking. We know that has driven some increases in cases in India. We are seeing increased hospitalizations and death in Southeast Asia, and it seems to be related potentially to this variant. we'll just have to keep an eye on it. We know that is the most contagious SARS-CoV-2 variant that we have seen yet. It's evades the immune system, gets around some of our prior immunity, just like the other XBBs. So we'll just keep an eye on that. And another one of the resources that I've looked to frequently and reported on here frequently is the CalCat website. It's the state of California, where they look at COVID and influenza, among other things. And you can see here that they've got an announcement about, since the May 11th into the emergency declaration, that basically the website is going to be updated less frequently, and they're kind of in a little bit of a transition period. So we are just going to have to hang on as some of these things kind of settle out, and we can find out what we can rely on and what we can expect. Briefly on Mpox, all I really wanted to say here is that there was a recent outbreak in Chicago. They reported on the first 12 cases in that outbreak, and I linked the report from the CDC in the post. If you're interested, I had reported on an outbreak in France a couple of weeks ago. Now this outbreak in Chicago. These are just reminders for us that Mpox has not gone away. We need to stay aware and vigilant. And there is also a fair bit of modeling that anticipates that we will see increases in Mpox cases over the summer, and particularly in a lot of the areas that saw high cases last summer. So this is something for us to be aware of. I wanted to point out a recent review in the MMWR, the CDC's weekly morbidity and mortality report, that was on the JYNNEOS vaccine. That is also linked in the post if you want to take a look, but it shows good vaccine effectiveness with 2 doses. So this was definitely reassuring, because we have been hearing about some breakthrough cases, but essentially the 2-dose series is offering good protection. And it just reinforces the fact that if you are someone at risk of contracting Mpox, it is very important to get both doses of the JYNNEOS vaccine. And given what I said about anticipating increases in cases over the summer, now is the time to get vaccinated, and we'll continue to keep an eye on Mpox activity. Now, today I wanted to take some time to discuss COVID and cognitive functioning. Cognitive refers to mental activities like thinking, remembering, reasoning, even our ability to process and use language. And there have been literally thousands of studies already looking at COVID and cognitive functioning. And I think this is partly because, if you remember from the very beginning of the pandemic, one of the first symptoms that we learned about was the loss of taste and smell. And so besides for that being unusual, these are 2 of our senses that are obviously regulated and tied to the brain. So I think from early on, there was questions about what it was that was happening with this virus and the brain. And the other thing that we heard about very early on was this phenomenon that folks are calling brain fog, that was persisting for quite some time in some people after they had COVID. So once again, speaking to some kind of impact on the brain. And this really struck us as very different from flu or other things that typically cause a respiratory illness, and that this was really causing some unique things that needed to be understood and still need to be understood. So for today, I chose 3 very different studies that I think highlight different aspects of this issue to briefly review, and they're all linked in the post if you want to check them out. I think each of them is important for different reasons. The first study was published in Lancet last August. I actually reviewed this in detail last August when it was first published, in a briefing that was dedicated to long COVID. So if you want to hear about this article in greater detail and some other studies on long COVID, I linked that prior briefing in the post. I'll just share some highlights from the study today. This was a huge retrospective study. That's why I want to share it. It takes a look back at about 1.4 million patients who were infected between January 2020 and April 2022. So that is spanning a couple different variants and a long period of time. And it was an international cohort. and it was looking at a network of medical records across the world. And they matched those 1.4 million patients with the same number of people who had not gotten COVID, but were diagnosed with another respiratory infection. And I actually thought this was very interesting and helpful, that they didn't just compare it to people who had nothing, but they compared to the same number of people who had another respiratory infection. And they looked at the risk of 14 different neurological and psychiatric diagnoses in these two groups, the COVID and the other respiratory infection. And what they found was an elevated risk of both common psychiatric issues like mood disorders, depression, anxiety, as well as more severe ones. Now, the more common ones like anxiety and depression, those eventually got better over time. And this study actually looked at 2 years out from the infection. And those folks with the anxiety and the depression eventually got better and eventually returned to their baseline and ultimately ended up looking just like that control group. And that was with the milder psychiatric issues, the depression, the anxiety, the mood disorders. But unfortunately, the risk of the cognitive issues, so the inability to concentrate or focus, diagnoses of dementia, psychotic disorders, seizure disorders, these were all significantly increased in the COVID group, and they were still increased at the end of the 2-year follow-up. So the more severe neurological and psychiatric issues were still persistent 2 years down the road. And these neurological and psychiatric outcomes were essentially the same during the Delta wave and the Omicron wave. So some of the mood changes, the milder ones got better, but the neurological and psychiatric issues that were more severe persisted up to 2 years in this very large cohort study. So these are significant and definitely concerning findings. They're on the large population level, so clearly we need kind of a more detailed and nuanced understanding, but these initial findings I think were really relevant. The second study that I thought was important looks at structural changes in the brain. And they investigated brain changes in 785 participants in the UK Biobank. And the UK Biobank is this large, long-term and ongoing biobank study in the UK. It's been going on since long before COVID. And they looked at 785 people between the ages of 51 and 81. And these were all people who had had MRIs. And they had these MRIs before they ever had COVID. And so 401 people had an MRI, and then they tested positive for infection with SARS-CoV-2. And then they had a repeat MRI of the brain, an average of 141 days. So that's 4 or 5 months later. And so 384 people had 2 MRIs with no case of COVID in between. So you have the two groups, 401 that had COVID in between their 2 MRIs, and 384 people that did not have COVID in between their 2 MRIs. So that was the control group. So having those pre-infection MRIs on file was really important here, because then we can really see what are the effects of the infection and kind of remove that that possibility that there could have been pre-existing findings on the MRI. And unfortunately, they did identify significant effects in the COVID group versus the non-COVID group on MRI. They found reduced thickness of the gray matter of our brain was thinner in certain areas of the brain post-COVID. They also found tissue damage in regions of the brain that are connected functionally to the area of the brain that controls smell. So the primary olfactory cortex. And they found reduced overall brain size in the people who had a SARS-CoV-2. So there's tissue damage, there's reduced volumes, reduced brain size after COVID. So these are certainly very concerning findings. They also did some cognitive testing where they gave participants different cognitive tasks. And there they also demonstrated on average a greater cognitive decline between those groups. Now, one thing to note here that I also thought was important is that they looked at this data when they removed 15 patients who were hospitalized. So they removed those patients from the data, and they still observed those imaging differences and the cognitive effects as well. So this indicates that even milder cases of COVID, or ones that don't end up in hospitalization, those were still resulting in brain and brain functioning findings. Now, we don't know here if the changes will persist over the long term, whether they could be reversed. And so we definitely need additional follow-up. The great thing about the biobank is that there will be follow-up. I'm sure there will be follow-up because that's what the biobank is sort of designed to do. And I think that we need more of these types of long-term studies to better understand the implications of SARS-CoV-2, but also of other types of exposures and disease states as well. And this last study that I wanted to review was published just a couple of months ago in March 2023 in Brain, Behavior, and Immunity Health. And this one was almost like two studies in one. The first part of the study looked at 120 fully vaccinated individuals, 18 to 84 years of age. And it looked at the association between having COVID and then how these individuals performed on 3 different computer tasks that are designed to assess cognitive function. And then it also measured the oxygen levels within the prefrontal cortex of the brain, so sort of the front part of the brain that is associated with a lot of important functions like decision-making, personality expression, behavior. And what they found among those who had COVID was significantly worse performance on 2 out of the 3 computer tasks. And this was actually found to be worse among older women than younger women or men. And they also found some reductions in brain oxygenation associated with them trying to perform those tasks. So they're trying to perform the tasks, they're not performing them as well, and there's not as much oxygen to the brain in a specific localized part of the frontal part of the brain. So these are significant findings that are both on the function as well as some sort of laboratory findings about the brain post-COVID. And then the second part of the study was a survey of over 2,000 individuals that looked at the relationship between having symptomatic COVID and self-reported symptoms of cognitive decline or dysfunction, or psychiatric symptoms like depression or anxiety or agitation. And this is all at the 6-month follow-up mark. And this part of the study had equal numbers of vaccinated and unvaccinated. And in this study, what they found across the board was that baseline symptomatic COVID history was associated with cognitive dysfunction and some psychiatric symptoms like anxiety, depression, and agitation at the 6-month follow-up. So basically, we see from this study that symptomatic COVID infection was associated with findings from performance on tasks that are designed to look at cognitive function, on functional imaging, and on self-reported indicators of cognitive dysfunction and psychiatric symptoms. So sort of on all 3 ways of looking at it, there were findings that looked like there was an association to having had COVID-19. So where does all of this leave us? I think first is feeling humbled that we still have a lot to learn. We are kind of in the baby stages of even learning about all of this. We don't have a very good idea of what percentage of people will have these brain effects. We don't know how to predict who will have these brain effects. We don't know how to treat these brain effects. We don't know what they'll look like over the long run. We really don't even have a standardized way to test for these brain effects or any specific imaging study that we've all decided we're going to look at to try to diagnose it. So we're still quite a ways away from having any kind of real grasp on this issue. And so for that reason, I was actually glad to discover as I was researching for today that there is an international multidisciplinary consortium of all kinds of scientific leaders. It includes the Alzheimer's Association and representatives from over 25 countries all over the world, including 6 continents. And they're receiving technical guidance from the World Health Organization, and they are evaluating the short and long-term consequences of COVID infection on the central nervous system. And they're really trying to better understand the long-term consequences that might impact the brain and cognitive function, and trying to understand what the underlying biology might be that might contribute to Alzheimer's and other dementia. So I am hopeful that not only will we learn more about COVID and the brain, but that this will also pave the way for a better understanding of Alzheimer's and other types of dementia as well, because we do not know enough and we do not have enough tools in our toolkit for Alzheimer's and other dementias, irrespective of this pandemic. And of course, the magnitude of this pandemic definitely gives us reason for concern about increased burden of these kind of issues. Still have a lot more to learn, but that is certainly the concern, and I'm glad to see that there are folks that are really focusing on this. And until then, our best bet is to avoid getting COVID in the first place, and to be treated if you are someone who should be treated. And if you are someone who should be treated, you should know that now. You're not waiting until you get it. You're not waiting to see how you feel. That is not how this works. You're either someone who should get treated, or you're someone for whom treatment is not yet recommended. So that's something you should sort out now before you need to. So to kind of recap, thankfully, cases, hospitalizations, and deaths from SARS-CoV-2 all appear to be trending in the right direction, and deaths are hitting all pandemic lows for now 4 weeks in a row. That's very encouraging, but we're still over 1,000 deaths per week. That is too many. We're still losing too many people to this infection. There's still quite a bit of COVID circulating. Some parts of the world are experiencing surges and increases in hospitalization and death right now as we speak. So it is important that we stay alert, especially knowing that this historically has been the best time of year for us here in the United States as it relates to the pandemic, and that we've also had summer surges every year so far. So we can certainly hope that this year would be the exception. I don't think we really have any data-backed reason to think that will be the case. We're certainly in a better position in a number of different ways, but as it relates to SARS-CoV-2 doing what SARS-CoV-2 does, we can expect increases in cases most likely. So it's important that we do stay vigilant and not contribute to unmitigated spread, because what we're worried about, of course, is worsening variants or a bad variant that would come about and kind of throw us for another loop. So the best way to avoid variants is to do what we can to control spread. And I am concerned that the reduced access to testing that we're now seeing because of the end of the emergency declaration, I'm concerned that this will mean that we miss opportunities to stop spread, especially spread to vulnerable people. And I'm concerned that we will miss opportunities for timely treatment, because that is so critical. So these are things we should all be very aware of. Find out now where you can get tested. Your primary care doctor should be able to offer you a test. They do swabs for all kinds of things. There is absolutely nothing that is different about SARS-CoV-2 of why they cannot test you for it, but you may need to call your office and find out what their practice is around this. I don't believe this should be an opt-out situation for primary care providers. but you may want to see what is the practice with your primary care provider. There may be an urgent care that they want you to go to. There may be somewhere else within the hospital system that they want you to go to. Find this out now so that you're not scrambling if you don't feel well. Also, don't forget to get your 4 free tests if you haven't gotten them already. They're available through the end of May. And we are still learning about the effects of repeat infections. We're still learning about post-COVID events and long COVID events, including all what I just reviewed. What we do know is that if you caught COVID once and you did fine, that's great, but that is not a guarantee about the next time. So we want to do what we can to avoid a potential bad outcome or potential post-COVID or long-term effects for you and the people that you're in contact with. So please do what you can to avoid getting infected or reinfected and spreading it to others. Gathering outdoors is always safer than indoors. If you will be gathering indoors, make an effort to improve your indoor air quality, add HEPA filtration units, keep the central air running with a MERV 13 or higher filter. Open up doors or windows. You'd be amazed what a difference just even opening the window a little bit can actually make, especially in smaller spaces. If you must spend time indoors with others, especially members of the public, wear a high quality filtration mask like an N95, KN95, or a KF94. Consider using rapid tests for pre-event testing, and whoever is positive needs to excuse themselves. You may also want to keep a guest list in case someone turns up positive later on. That way you can contact folks. If you test positive, contact anyone you were around, especially if you were unmasked, for the 3 to 4 days before you started symptoms or before you tested positive. If you spend time with someone unmasked who would be treated for COVID, then please be extra careful. You do not want to be the one who gives them COVID. And you'll need to get tested timely. They'll need to get tested timely if you were exposed and if you have symptoms. So you may want to go ahead and get the more definitive PCR test, since antigen tests do take longer to turn positive, because remember, you generally only have about 5 days to start treatment, and the sooner the better. We could significantly reduce that 1,000 people a week dying and that 9,000 people a week being admitted to the hospital if everyone who was eligible got outpatient treatment. And if you do test positive, please make sure that before you exit your isolation, you do an antigen test to exit. In general, we believe that enough virus to detect is enough to infect. And please don't push yourself. Try to give yourself the time you need to fully recover. Also, please don't show up to work or school feeling sick and exposing others. Stay home and rest. But if you absolutely must go out, a well-fitted N95 mask could keep you from sickening or even killing another person. And remember to eat a balanced diet, incorporate fruits and vegetables, avoid sugary drinks, consider a multivitamin supplement, get your blood pressure checked, get your baseline labs checked, like your sugar, cholesterol, vitamin D, get some regular physical activity. Unless you're sick, in that case, please get your rest, manage your stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.